So I'm going to go ahead and get that started. Um, all right. So again, if you are just joining us here today, we'd love to know where you're located in the state, where you work, or what organization you represent. It just gives us an idea of who's in the audience. So we want you to have fun with us today. Feel free to interact with the chat. I have a coordinator here with me, Sarah Heibel. She's going to be answering questions. Appreciate her assistance on this. So just as a reminder, we're going to record this webinar today. I will send out later today a copy of the recording and the slides. So I invite you to just kind of sit back and listen today. But feel free to throw questions into either the question and answer section of the webinar or the chat, and we will get to those questions. If I have an opportunity, I see them, I'll answer them right as they come in. Or at the end, we will have an opportunity to let you ask some questions. So just want to welcome you here and thank you for being here. I also want to give you a preview of the content that we're covering today. We will be discussing topics including stillbirth, birth outcomes, and disparities in health outcomes. So if at any point in this presentation this becomes activating for you, please let us know. It's okay to step away. We will not be offended. You can always come back to the slides and information at another time if you like. In addition, some of the research that we referenced today uses gender-specific language like women or moms due to original parameters in the research studies, but we acknowledge and note that any individual of any gender identity who are experiencing pregnancy can use the Count the Kicks tool. So you're going to hear us use gender-neutral language throughout the presentation as well as the term expectant parent. So as we get started today, I brought you in, I asked a poll, and it looks like this is a great audience today. So about half of you have heard about Count the Kicks before, and about half haven't, just a little bit over that number. So I'm grateful to be with you to provide this information. My name is Sarah Coleman. I am the State Expansion Director for Healthy Birthday. I've been here for about a year, and I'm excited to bring this information to you. My background, I've been a couple different places. I started out in nursing, worked in L&D, worked as a doula, and all the various things that come alongside that with lactation and childbirth education. And then I actually made a shift to K-12 education, and I've held several roles: teacher, administrator, school district. Out in Denver, I worked at the district level, providing information about health and health sciences. So I'm pleased to come back to the maternal child health world and be here with Healthy Birthday. So let us get started. Those of you who have not heard of Count the Kicks, what we hope to do is be able to save babies together. So this is a highly effective evidence-based program, and it is a proven early warning system that was developed in Iowa. And we're going to share some data about that. We're going to show some evidence from our Iowa campaign, but basically we were able to save and continue to save 1 in 3 at-risk babies across Iowa. And we have worked really hard to duplicate those results in Georgia, and we need your assistance in keeping this program strong. So I'd like to share a Good Morning America clip so you can kind of get an intro of what this looks like for expectant parents.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So speaking of baby saves and the impact, this is baby Kai Dalton, and this is a baby that was saved right in your state in Georgia. And that is because a doula shared the Count the Kicks app and importance of kick counting with Kai Dalton's mom. So during Kai Dalton's pregnancy, his mom learned about the importance of kick counting from the doula, and she took the doula's advice, downloaded and used the app regularly. And it's to note that this pregnancy was considered high risk. So she was going in weekly for non-stress and biophysical profile testing to monitor. And around 37 weeks, she said, Kai Dalton was telling me something was very wrong. I'm glad I had knowledge about his movement, so I felt empowered to speak up. So she advocated for herself and went in and had, she delivered Kai Dalton, and he had his cord wrapped around his arm and neck, which was limiting his movement. So this is a right there in Georgia story that we're pleased to share with you. And this is just a little bit of the picture of what stillbirth looks like in Georgia right now, and we want you to know that we are invested in helping to save babies in Georgia. We believe that 333 Georgia babies could be saved on average every year just with the implementation of this program, and recognizing that there's a need for fetal movement monitoring conversations. And so we're thankful for the Georgia Department of Health for sponsoring us and helping to get this information out. So I want to kind of level set and talk about some of the causes of stillbirth. So some stillbirth, we just don't know what the causes are. There isn't a definitive cause that we can point to, but research points to possible contributors that you can see listed here. And I want to call special attention to an older infection that's being diagnosed at unprecedented rates. We haven't seen these rates for 70 years, and that's syphilis. So during pregnancy, syphilis can spread from a mother to her unborn baby. So this would cause what's called congenital syphilis. And if congenital syphilis is left untreated, this can increase the risk of having a stillbirth. But please note that congenital syphilis is, you're able to treat that during pregnancy. So it's really important to get that diagnosed early on. And what we know about this number is that 40% of babies born to women with untreated syphilis can be stillborn or die from that infection as a newborn. So again, this can increase the risk of having a stillbirth. And we would ask you to help us improve those birth outcomes and prevent syphilis-related stillbirths by talking to expectant parents about their risks and encouraging them to get tested at their first prenatal appointment. So, and it's important to note that partners should also be tested. So just as we've talked about some of the causes that are known through research, let's get into the research and the data. So Count the Kicks is based on a research study that was published in Norway in 2007. In the study, researchers worked with health systems, so like birthing hospitals and OB clinics across Norway, to educate expectant parents on getting to know what their baby's normal movement looked like. And they also empowered them to speak up if they noted a change. So a change in babies' movements can be a red flag. This is the whole reason that we're interested in talking about this. A change in movement can be a red flag during pregnancy. It can also be a precursor to stillbirth. So these researchers let expectant parents know that they should alert their doctor to investigate if the baby was in distress and take action if needed, if they were seeing a reduction in movement. So this system change work in hospitals across Norway led to a 30% reduction in Norway's stillbirth rate. So Dr. Ruth Fretz, she's an original researcher, you can see circled here. She now sits on our medical advisory board. So our founders in Iowa saw this research and said, you know, great campaign start in Iowa. Let's see what they've done and bring it here to Iowa. And their goal was, even if we save one baby, it will be worth it. And so again, I just think of that image of Kai Dalton. That is a baby that's been saved through this campaign. So if you're curious to know what our Iowa data looks like, this is kind of the life of our campaign through 2022. The red line at the top represents the national stillbirth rate, and the teal dots and that trend line, that highlights the Iowa campaign. So our campaign started in 2008, and you can see that the trend line just starts going down from right there. And it's important to note that there can be changes. When you look at the data, you got to look at the averages, because things like a pandemic or syphilis can definitely cause those fluctuations and cause spikes, but there's a variety of factors that go into this. So what we want to see is that trend line going down. So that, again, is what we're basing our campaign on. And I'd also like to draw your attention to, during the first 5 years of our program, we actually saw an impact on racial disparities here in Iowa. We saw the African-American stillbirth rate decrease by 39% in those first 5 years of the program. So this is really significant. As you consider evidence about our campaign, we have been published in the British Journal of Obstetrics and Gynecology. That was last year. There's a QR code for you. And this study showed that the stillbirth rate in Iowa, this was again looking at our Iowa research, went down 1% for every 3 months during a decade. So across a decade, we saw this decline. This is much faster than the other US population rates were declining. So that told the researchers that were looking at this that something was happening in Iowa over this decade that was not happening across the United States. We have another study published in the American Journal of Obstetrics and Gynecology that addresses other parameters and shows that evidence that this campaign works. So feel free to scan those QR codes, take a look at that information if you're really interested in the numbers and significance. So something new for us, I'd like to point out, this is another thing you can look at through a QR code. So AWHONN has recently released a practice brief about decreased fetal movement. So this is a milestone because this is the first time a nationally recognized medical organization has issued a comprehensive bulletin underscoring the crucial importance of fetal movement monitoring. So this sheds light on a lot of the various aspects, possible intervention points, emphasizing the need for education during pregnancy. And these key components really align seamlessly with Count the Kicks. So we worked with AWHONN to produce this brief, and just calling your attention that the focused assessment and management of decreased fetal movement or significant changes in fetal movement patterns by perinatal clinicians is essential for improved fetal outcome. So that's kind of bringing that all home in their outcomes. That's what they state. So you're going to hear me talk about fetal movement monitoring and why it's so important throughout the day today. And again, anxiety, thinking about maternal mental health. If you look at these studies, and these are found in that AJOG article, that we survey our app users. So the app is completely free. There are no ads, but we do offer opportunities for people to give us feedback. And a survey of app users showed that 84% felt that the regular tracking of these fetal movements associated them of feelings of bonding with their baby. And they reported feeling less anxious about fetal movement and the pregnancy in general because they were using the Count the Kicks app. So I'd like to share a story. We talked about Kay Dalton, and I'd like to share this story from Destiny. You're going to hear us talk about those disparities, and we want to do everything we can to close the gap. So this is a video about the equity work that we do.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the kicks just, I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
So, something that occurred to me as I watched this video is, there at the end, Nala's mom says, I think about this every day. And I can tell you that I think about our baby saves every day. And when we hear the stories from expectant parents about saving babies, we hear from lost moms. Those stories really make an impact across our organization. And so we do keep faces in mind, and we want to make sure that we are doing everything that we can to get the word out. So take a look at these trends. It's very clear that there are vast differences in the stillbirth rate that affects Black, Indigenous, Native Hawaiian, and Pacific Islander communities. So we know that these disparities exist. They persist despite changes that we're making with in systems. We're addressing systematic racism, but we have a lot more work to do. So we're committed to that work at Healthy Birthday. These are some of the things that we are doing. We are making sure that we are representing diverse populations in our web presence, in our social media, our educational materials. We currently have 16 languages in our app, and we will have several more added very, very shortly. And so anyone can use the free app. They can change the language to be something that they may be more familiar, the native tongue. And so that's a really important opportunity for us. We have a health equity specific role at Healthy Birthday. And that person, Christine, is charged with engaging with more diverse communities and honing in on data that can inform best practices to improve our birth outcomes. So we're continuously focused on DEI training of our board, our staff, and our ambassador team. So those are just some of the things that we are doing to keep equity and disparity at the front of what we do. So again, why does movement matter? Why does Sarah keep talking about fetal movement monitoring? Well, movement is the way that baby communicates before birth. And so a change in baby's movement can be an early sign, sometimes the only warning that a baby may give when it's in distress. And what we know from the stories that we hear is that minutes matter. It is critical to have something in place. If you're a provider, a protocol in place that if someone calls with decreased fetal movement, what do you want them to do? And we'll talk about that when we get to systematic change. Before I keep going though, I just want to invite you, if you have any questions, I'm keeping my eye on the chat over on another screen. So I'd be happy to answer any questions that you have about the research or movement monitoring. So when should a mom start counting movements, and how do we want them to do that? Well, let's talk about that. So ACOG recommends beginning to count at 28 weeks gestation, 26 weeks if someone is considered high risk or they are pregnant with multiples. And research shows us that this is when both mom understands that the kick counting that's occurring, the movements that are occurring, she can distinguish that. And also that there's some regular patterns happening from baby. So what counts as movement, rolls, kicks, jabs, swishes, anything but hiccups, and hiccups are involuntary movements. So we're looking for those voluntary movements. So how do you do this? These are the steps. This is a graphic that can be shared with expectant parents. And so let me just provide a very high level overview. So again, we're starting at that third trimester. We want an expectant parent to monitor with the app, which is free. They can also download paper kick counting charts, and I'm positive that Hybels will throw that link in the chat for us here today. So if you're interested in our paper kick counting charts, they come in several languages as well. So once they have that system in place, they've downloaded, we want them to register. If they register for the app, they're going to see a longitudinal perspective. If they're not registered, they're only going to see a couple days of movement. So we're really looking for a trend, and you want to see more than 5 days of movement to be able to have a conversation with a provider that you know that there is a difference. So really, really encourage people to register. We do not sell information. Again, that we're not tracking in any way. We invite opportunities to share feedback. There's no pop-ups. So we've really tried to make this comfortable for individuals to register. So counting movements every day. We want this to happen at the same time with every pregnancy. So the same time every day, every pregnancy. If it's pregnancy number 1 or pregnancy number 4, every baby is unique. So when you're picking a time, just pick a time when the baby's, you've noticed that the baby is normally active. And then what you're going to do is just time how long it takes to get to 10 movements. And then you're going to rate the strength of your movements. And I'll show you a little bit more about that when we look at the app, how we're looking for those movements, how we're tracking the movements on the app, and also how we're actually monitoring on the app the strength of those movements. So after a few days of doing this at the same time every day, you're going to see an average length of time. You're going to see normal pattern emerge. And so as an expectant parent continues that through the pregnancy, when they notice that something is off, when they notice a change in strength of movement or time it's taking, we want them to call you, the provider. We want you to tell them it's important to call your provider. If you are a WIC clinic, doula representative, home visitor, there's a way for you to be involved in this. So what I'd like to do is give you an opportunity, and I think I'll put some Ray Charles music back on. So we would like to give you an opportunity to order materials today. And if you need a little bit of break, we've been going at this for a little bit of time. Stand up and order some materials. Think about who you could share this information with. Hybels is going to put a link in the chat. You go to counttthekicks.org. and you select Georgia from the order materials over on the left-hand side of your screen. We're going to give away 2 gift cards today, 2 Amazon gift cards for orders that are placed during this webinar this morning. So if you are here, you have not ordered materials yet, or if you've ordered materials and you want to try other things, we're going to give you an opportunity. That link is in the chat to order things. So I'm going to put back on Mr. Charles and give you 2 or 3 minutes to place an order and stand and stretch.
Georgia, Georgia, the whole day through. Just an old sweet song keeps Georgia on my mind. Georgia on my mind. I said, Georgia, Georgia, a song of you. Comes as sweet and clear as moonlight through the pines. Other arms reach out to me, other eyes smile tenderly. Still in the peaceful dreams I see, the road leads back to you. said, Georgia, oh, Georgia, no peace I find, just an old sweet song keeps Georgia on my mind. Georgia on my mind. Her arms reach out to me. Her eyes smile tenderly. Still in peaceful dreams I see the road leads back to you. Whoa, Georgia, Georgia, no peace I find, just an old sweet song keeps Georgia on my mind. Georgia on my mind. I said just an old sweet song keeps Georgia on my mind.
So the musician in me wants that not to end. I love that song. So we'd like to introduce another Baby Save to you today. And you have an opportunity throughout this webinar to place those orders. So if you're just thinking about what you want to have, please know that you can place those orders throughout the morning and at any time. But to get those Amazon gift cards, we want you to do it this morning. So thank you again to the Georgia Department of Health for making materials free in the state of Georgia so we can get them into everyone's hands. So this is Baby Save Zoe, cute little bundle. And I just want to draw attention to the story from Melissa, Zoe's mom. And she said when she noticed a decrease in movements, she was able to use the app. So we want to get into looking at what this app is, because Melissa is able to show her provider the longitudinal information to present to her provider that something was wrong. So she was empowered to speak up because of the app. So I'd like to show you this multilingual PSA. And this talks about some of the ways that people can count. And then we're going to get into the app.
Whether you're counting on the go,
आराम से, घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre.
C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé.
सशक्त महसूस करें. Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues.
Application download करें
or visit counttthekicks.org for more ways to count.
देर ना करें, आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas, commencez à compter aujourd'hui.
Don't delay, start counting today.
All right, so here is the app. This is our Hallmark tool for the campaign. And again, it's totally free. It's very easy to use. I'd encourage you to download it. It's available on Apple and Android, even if you're not an expectant parent, just to see how easy it is. And then if you have clients who want to know more about the app, you could actually whip out your phone and show them just how easy it is to count. So that PSA talked about all the different languages and highlighted some different opportunities. But we, again, just want parents, expectant parents, to choose the same time every day in the third trimester for every single pregnancy to take an opportunity to count. And so if they're using the app, what you can see on the phone with the footprint on it, that is a timer. And every time the expectant parent feels a movement. So again, the roll, the kick, the jab, or just a elbow to the ribs, whatever it might be, they'll just touch that footprint, and that will record it as a movement. With the first one, a timer starts. So as soon as that circle is completed, after they're touching that footprint, every time, what will come up is that what you see on the next next screenshot of the phone, and that is the strength tracker. It'll just ask them, it'll say, so how strong was this kick? And was it very strong? Was it just a lighter kick? There's just a scale for parents to register for. So research shows us that we should not only be paying attention to how long it takes baby to move, but to pay attention to the strengths of movements. So they'll get expectant parents will get a visual representation, of how baby has been moving and the average time that it takes to get their 10 movements. So they've got these metrics that they know. And one of my colleagues says this is a data download of intuition and knowledge. And I think that's so true, because an expectant parent can show a provider and say, I know my normal looks like whatever it is, 17 minutes. And I know that these kicks are fairly strong every day. So today, something is different. And they have that evidence from the app to show that. So other features on the app include the ability to count for single babies or twins. They can set a daily reminder. And then something else that's really awesome is, and this is set there in Georgia, is finding local resources by zip code. So thinking about the social determinants of health in your work, if an individual is in need of employment assistance, housing, maybe they want to know where the nearest food bank is, they can search by zip code under resources in the app. So that's another benefit of using the app and having that ability to track that. And then speaking of social determinants of health in Georgia, in an effort to get the expectant parents critical resources before their baby's born, we're taking a look at social determinants of health in the state of Georgia and across states. Other states have this survey added, and so it is completely voluntary. Someone can volunteer to provide this information so that we can learn more about the needs that are there. And then they are able to quickly connect to a resource indicating, if they've indicated they needed coping skills, it will automatically link them to something from the Find Help story. And you can customize this. So if there's a resource in your community that you would like us to have for Georgia users, feel free to email me and let me know, and I'm happy to get that resource on. And just want to highlight that last year we launched the web kick counter. So if an individual doesn't have their own phone, if they are not able to count, on their phone, they can go to a public computer, they can use a friend's computer and log into their account. So this is something that we're seeing a little more often in libraries. Libraries are asking us for Count the Kicks information because they're seeing people come in and use the Count the Kicks website to do their counting. So and remember, we have those printable downloadable charts. So that is something else that can be available at a library, or just as you're working with folks, you can pass that out. So let's get into systematic implementation as we're going. And I know I saw in the chat, several people were sharing where they worked. I saw we have some home visitors. I think I saw a doula or two in there. So let's just talk about some things that are specific to those roles. So home visitation, we know that home visitors can have a huge impact on birth outcomes. And one thing that I'll just highlight as you're looking at this, a story that was shared with me last year from a home visitor in Wisconsin, is she noticed that there was an opportunity for one of her expectant parents who had younger children. They counted together. They did reading time after lunch, and one child held the app to do the footprint, and the other child was like, oh, there's the kick, and confirming with the expectant parent. So they were doing that together. So there's an opportunity to look at early language development and early learning at home. That's really awesome. That's a great strategy that you can employ as a home visitor. And then if you are in WIC, we know that WIC serves 800,000 expectant mothers each year. That number is probably lower than what it truly is. And we also know that 4,790 of those expectant parents will lose their baby to stillbirth. And so as a WIC clinic, you can have this information available to expectant parents. You can put the posters up, you can share with them at visits. And so there's an impact there. And then doulas. Recently, one of our ambassadors, Takesha, spoke at the Doula International, conference up in Minnesota. We know that you are providing information to your clients that you're serving, and they trust you. And so we want you to encourage and educate them to use Count the Kicks. And if something is different, if they're noticing something, empower them to speak up. So we really want to highlight that individuals that work in those capacities, you are super, super critical to this work as well. It's not just providers, it's everybody who supports expectant parents. So there's a couple tips here on the screen about engaging and educating your team members, but also thinking about how you can engage and educate expectant parents that you come across. And so just think about how you can implement this in your specific system using some of these tips. And again, I'm going to share this information, the slide deck, so you don't have to be writing anything down. I just want you to be thinking about what this could look like in your specific system. So I just want to pause and have you think about, just take a minute here as I'm talking. And I'll give a pause so that you can write something down if you'd like. But brainstorm 5 people that you could share this information with during the course of your work week. What would you need to know? Are we answering your questions today? So thinking about those people that you might engage with, and then what might you need to know? And I'm just going to pause for a second so you can think about that. Get a little drink here. So let's talk about misconceptions. So again, as you're thinking about the things you might need to know, sometimes misconceptions come across our desk. And if you actually think of a misconception that you'd like addressed, we have a frequently asked questions sheet on our website. So some of the misconceptions are addressed there, but I like to ask for those questions here so that we can help you. This is one that we hear quite frequently. If baby isn't moving, I should drink something cold or eat something sugary to get baby moving. And I remember hearing this in nursing school, that was probably the first thing we should do if somebody called into L&D and said this, is to tell them to drink, I understand I'm talking to a Georgia audience, so a Coca-Cola. I would say Dr. Pepper, but I'll say Coca-Cola for you all. So drinking a pop with caffeine, getting something that would, quote, get baby moving. And while that might get baby moving, if it's not the normal movement, we want to see a movement without intervention. So if baby isn't moving like normal, we just encourage the connection to provider right away. We also have heard other myths, and I want to play this short clip here from Jen Hamilton. She's a well-known social media influencer. She's an OB nurse. So let's listen to her as she describes more about her view of Count the Kicks.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movement and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
So, and I know we have a question in the chat that I want to address too. So here are some things that when we talk to our app users, when we talk to expectant parents, we hear from them that the things that their provider says to them, the guidance that their provider gives to them is really important. So 87% of our app users said that they would contact their provider if they noticed a change in their baby's movement if their healthcare provider encouraged them to speak up about a change in movement. So a provider's influence on expectant parents is strong, and they need to hear from you about why tracking fetal movement is really important. So thinking about some of the ways that you can talk with expectant parents, there's some examples here. It's really important. You know, we talk about SUIDs. We're talking about that at multiple points during a pregnancy. Pediatricians, when you meet with them, they're talking about SUIDs, back to sleep campaigns, highly successful. We want to see the same attention given to stillbirth. We want parents to know and understand that there is a risk, but there is a way that they can participate in preventing that risk and speaking up. So I noticed a question in the chat, and I think this is a good time to just address it here. Do stillbirths tend to run in a family? Is it genetic? And I think there are some research papers out there that indicate that there can be familial patterns. I would love to be able to research that though, Renee, and give you some links if you want to share your email, if you want to email me. My email was up at the top of the chat. I'd love to share those specific resources. What I will say is that we know that there are some genetic diseases that occur, hereditary patterns that may result in stillbirth. And so that is something known that I could answer for you here today. So systematic implementation, let me go back here to systematic implementation. So thinking about adding materials to the discharge paperwork. If you're a provider, if you're a clinic, if you're a WIC clinic, think about that touch point that you have as you're working with individuals. It might not necessarily be part of the discharge process, but it might be part of your paperwork, your forms that you're doing during that third trimester. So where might that fit? And if you need some suggestions of EHR integration, we have examples from health systems here in Iowa and other states. We'd be happy to share with you what that looks like. So thinking about your team, make sure that anyone who has contact with an expectant parent is trained to discuss count the kicks in the third trimester. And again, it's just saying all the time, every day, same time, every pregnancy. We want that to happen. So having app reminder cards when someone checks into a desk, those are the little tiny cards that you saw on the website to order. That can be something that right as people walk in, they see that as they check in next to business cards, having posters available. Think about that intake summary as people are coming in and you're checking them in. If you're using case management forms, include count the kicks information for the third trimester. And the procedure time, I think this is such a valuable place to do this. So after someone gets checked in, if they're waiting on a glucose screening, they're having labs drawn, an ultrasound, or maybe they're just waiting on the doctor and you've done their blood pressure, hand them information or point over to the chart and say, hey, you're coming up on the third trimester. Why don't you download the Count the Kicks app while you're waiting for your provider, for your midwife to come in and see you, just to get familiar with that. And then finally, we have audio recordings and waiting room videos that we can share with you. We'd love to share those with you so that you have that information running for expectant parents to see every day. So hang with us. I'm coming to the end. These are our next steps. Think about some of the things that you can do as a system and as an individual. So familiarize yourself with the Count the Kicks app. Just download it if you've got some downtime, you're traveling, or maybe on your lunch today, you want to play with that. But practice and know how to answer questions and kind of troubleshoot if expectant parents tell you that they're not sure about something on the app. Order materials. So I'm going to put one last plug in here today. We're going to give away 2 Amazon gift cards. So please complete those orders today and get materials in to the offices that you are working from. And here's another tip. Make sure that you have somebody that's got their eye on it as part of their daily routine. Are we low on brochures? You know, do we need another poster over the scale? Just have somebody be kind of the point person. Take time to educate. Make sure you're having the kick counting conversation at every touch point in the third trimester. That's why it's so critical that everyone is trained in it. And make sure the whole staff knows about this. Share the webinar recording that I'm doing today. Share the slides. Talk about ways in your system to implement. And guess what? If you have ideas of how this could be implemented, share them with us. We want to share that wide. We want to share that to all the states that we work with. So if you have an idea, you haven't seen it today, let me know. I'd love to hear about it. And then debunk misconceptions and encourage people to speak up. So sometimes we have, you know, older generations have some things that they, you know, that are just kind of built into what happened with their pregnancies. And when we get new medical research and we look at those changes and patterns, we just want to make sure that everybody is debunking misconceptions and they're talking about stillbirth, and we're empowering expectant parents to say something's not right. So again, I'll say it. Remember that hours and minutes matter in prevention. So this is where I come back to the statement I made earlier. If you're a provider and you are, you know, you're working with clients who it will take a long time for them to get to the clinic, whether they don't have transportation access, whether you are in a rural area serving a rural population, for whatever reason, think about the message that you want your expectant parents to hear when they notice something's different. Do you want them to call you? Or if you know that it's going to take 2 hours for them to get to the hospital, do you want them to just start coming to the hospital if they know something different? Communicate that to your patients and the population that you're serving. Because we want you to make those decisions, those medical decisions, but just communicate how you want your patients to act when they have that information. So we're in the final throes of this. Here are some resources. I just want to share again. Here's those materials. Get those orders in. You also have 2 fantastic ambassadors in Georgia. Your ambassadors are located geographically. They're happy to serve at events that they can come and attend. So if you have something like a baby shower, community baby shower, you'd love to have them attend, or maybe at a WIC clinic, you'd like somebody to come and answer questions or talk more about Count the Kicks, let us know and we can get you in contact, or you can record their email addresses here that you see on the screen. So we'd love to connect you with them. If you are somebody who likes kind of the research, the nitty-gritty of that, we have a CE training that I would encourage you to take. That code is actually, sorry, I missed this one, you guys. This should say GA, Save Babies -GA. So there are some codes available still for a free training. So if you're looking for those CEs, you can take that, and I'll update that when I send out our code today. Our final email, I'll update that code. And then just finally, we have a very active social media manager. If you're looking for more information about us as an organization, the advocacy that we do, opportunities for learning more, like our A1 pathway, we're going to have a webinar dedicated solely to the A1 pathway on February 15th. We'd love to share that with you. Go to the Healthy Birthday social media. Our Count the Kicks platform is more expectant parents focused, and you're welcome to reshare that as an organization with your expectant parents. And then finally, we have a newsletter. So that newsletter provides you with all the updates monthly. So this time, let's see if we have some questions I can get to for you. If you have heard what you need to and you're ready to return to your day, thank you so much for joining us. Thank you again to the Georgia Department of Public Health. We are so grateful to them for sponsoring our program. So let me see here. We get the chat. Becky, this is a great question. So are moms in substance abuse recovery at increased risk of stillbirth? I'd love to be able to get you some resources for that. This is just something that we're starting to learn more about at Healthy Birthday. We're learning from the research that's being shared with us. So I would love to answer that question, but I need a little time to look through our resources. If you want to send your email to me, I would be happy to get back to you with that question. It's an important question. Thank you for asking it. I just want to make sure I give you the correct research, evidence-based information as an answer. So thank you for asking that. All right, let me look through the chat. I think we're good. Thank you again. I'll hang out for a minute and see if there are any more questions that come in our chat. Otherwise, have a great morning, and thank you again so much for joining us and for helping us to save babies in Georgia. We are so grateful for you. So stop sharing here and we'll stop recording. Oh, I see, maybe we got one more.